Hello everyone, welcome to my YouTube channel SD Nursing Classes and Exam Preparations. Today our topic is about the differentiate between the therapeutic and non-therapeutic communications. Means already we studied about therapeutic communications, its everything, its goal, its purpose, its characteristics, techniques and what are barriers. So today we will discuss about the positive and negative, means what is non-therapeutic communications, means what all negative sense may occur while dealing with the patients, therapeutic and non-therapeutic, what is the difference between them. So let's start the topic. So today our topic is what is the difference between therapeutic communications and non-therapeutic communication. Difference between therapeutic communications and non-therapeutic communication. This is our topic, means how we can differentiate between the therapeutic and non-therapeutic communications. Already we studied about therapeutic communications. Everything we study means all the what is types of therapeutic communications, then purpose, then goals, then characteristics, techniques, barriers. So everything we studied in detail. So today we will discuss the what is the difference between the non-therapeutic communication and therapeutic communications. You can easily differentiate between them. That non means that is negative only, which is not involved with the patient. So very clearly we can understand here. This is therapeutic communication and this is non-therapeutic communication. This is therapeutic. Sorry. This is therapeutic communication. Therapeutic communication and non-therapeutic communication and therapeutic communication. In this line, in this what to say, so क्या बोलते हैं ये वाला खड, okay. So फिर से बोलती हूँ. So what all about the therapeutic and non-therapeutic differences. So this is the therapeutic communications and this box is for non-therapeutic communications. So we will differentiate these two very easily. So first one is the goal. Goal means first here what? Foster understanding, trust, positive connection. Everything is what in very positive. Means what? That is foster understanding, to encourage the patient and the client and the family member, and trust there. When our communications will be strong, automatically the trust and positive connection will be improved in this goal. So already we studied about that. But here may hinder understanding, create barriers or lead of conflict. To means what happened here? So the easy things they make very unclear. Hinder means what? Unclear. Clear. So that is not clear things, means you only make patient totally confused. And hinder understanding means the things which is not properly understand between the patient and the nurse. So that things will be happen in non-therapeutic communications. But in therapeutic communication, what happen? Everything easily they can understand each other when, because of the nurse gesture, posture, his behavior, her behavior towards the client. So for that, what happen? Client also cooperate with the nurse and easily they can understand the topic. But in non-therapeutic communications, what happen? So that will be more difficult to understand something the nurse is saying and the patient is taking differently. Means we have studied in barriers. So whatever we are saying, he is understanding in different way. So this type of situation may occur. So this is comes under non-therapeutic communications. And at last, what will happen? That lead to conflict because of their misunderstanding, it leads to what? Conflict. At last, what happened? That leads to conflict. So this is what non-therapeutic communications, which we have to avoid. We should always, in our therapeutic communications, our relationship, our goal, our everything should be for the beneficial of the patient only, not for us. So we should do what to make him understand, to make him politely we can discuss the topic, and by their mood, by their posture, how they are feeling, accordingly we have to deal with them, accordingly we have to talk with them. So this is the first one. Then focus, we will see. Here our focus is what? Patient centered. Means our main focus is what? Who is here the focus? The patient. And emphasizing empathy and active listening. Everything means we have to understand patient's feelings, his requirement, and we have to be always give importance to patient only. His feelings, his understanding, his requirement, everything we have to understand, and our focus should be there only. Means how we can give a better treatment to the patient. But in non-verbal communications, what happen? Maybe self-centered, lacking empathy, or genuine engagement. Means how we can show the positiveness to the patient, everything being negative. You are not genuinely engagement or participant with the patient. You are not asking any question to the patient. Simply just what is your wish, what you want to do, just you are doing that without being any type of importanceness, showing any type of empathy to the patient. You are just thinking about yourself. The center point is you are thinking that you only the center focus. So these things, lacking empathy, you are not having the feelings for patient, that how the patient is feeling and what is her requirement. So your engagement, your empathy, your focus, everything is zero here. You are just focusing yourself, how I am looking, what is my, how I am feeling, that accordingly me only everything should be happen. So like that you are thinking. So this is what, this is totally negative, means non-therapeutic communications. So here what happened, our everything will be our plan, our goal, our whatever our plan for the patient, everything will be disturbed. Your communications will be totally zero. So always we have to focus in therapeutic communications. Our main motto is that we have to provide good care to the patient as soon as possible. Patient should get cured and discharged. So our feelings, their feelings we have to understand, and always we should think about the patient. This is what focus. And yes, already we studied about two types of communications, verbal and non-verbal. So verbal communications, whatever we are talking to the patient, it's very clear, conscious, supportive, and language. What language we are talking to the patient, accordingly the patient, what patient can understand, that language only we have to use. So that language should be clear, which patient can understand, and consciously we can talk to the patient, supportive and language. So these all are what positively you are dealing with the patient. And then what? Ambiguous, judgmental, dismissive. So here what happened, the language which you are using, that is unclear, or that is misinterpreting to the patient's feelings and his words. Means what patient is saying, you are just not listening and you are just misinterpreting unnecessary. You are saying something differently, you are not listening to the patient, and judgmental, so showing rudeness to the patient and asking them only questions, interrogating the patient. So this type of things, this is what totally non-therapeutic communication. Dismissive language, the language which you are using, patient is not understanding, and but then also you are not thinking about the patient. Oh my god, what language I'm using, maybe patient is not understanding, I have to make him understand in his language, in which way patient can understand, I should talk to him. So these things is not coming to you, not your sense organ, not your sense of humor is not telling you that what I'm doing. So this is what, this is totally non-verbal communications. But verbal communication, everything is clear, conscious, supportive language. So this is what verbal communications. Then non-verbal cues. Means while talking, while in non-verbally, means this is the medium, by writing, by body language, by posture, we can understand each other. So this is what non-verbal, by without using the spoken words, only the written and the body posture and their behavior, their language, body language, we can understand the patient. Already we have studied about this. So here what happened, open body language, eye contact and attentive gesture. Means our body language is totally like that, what patient is doing. Means we are observing the patient, we are sitting with them and our eye contact is there. If patient don't want to talk, then what we have to do, by absorbing the patient, by sitting with him, by creating empathy situation, to the positive environment to the patient, and attentive gesture, we should be in positive gesture to the patient. So this is what, this is therapeutic communications. But in non-therapeutic communications, neither the patient is talking to you nor you are showing any type of good gesture or posture to the patient. Means closed off posture, lack of eye contact, distracting gesture. Means already patient is in depression and you are going and you are just seeing, you are not even seeing to the patient, you are just seeing the file, where is file, yes I have to fill up the file and this all that all, and you are not even seeing the patient and not showing any type of empathy or any gesture, good gesture, body posture, you are not sitting with the patient, you are not doing eye contact. So this is totally non-verbal communications. Means non-therapeutic communications. In non-verbal cues, this come. And next is what, empathy and validations. Empathy and validations means what? Empathy means to feeling somebody's feeling, his mood, we can understand that. And validation means, yes, you can confirm whether it's which question you ask to the patient, patient, what patient is saying, you can confirm that one. Did you say like that? please repeat me, I didn't hear. So this type of things, this is what empathy and validation. So these all things is there in where, in therapeutic communications. Emphasizes understanding, validation, feeling and emotion. Yes, these things are what, these all are there. We can understand each other's emotion, and emphasizes the understanding means we are giving importance to their feelings, their words. And validations feelings means, yes, I told you that, yes, we can ask them that what you say, would you please repeat, or I didn't hear. So we are giving importance to the patient totally, his emotional level, his feelings, his words, everything we are giving importance here. But in non-therapeutic communications, what happens, everything lacking, may lack empathy, invalidation emotion, or offer false reassurance. You are just, if the patient is asking you that when I will go to my home, unnecessarily he is just disturbing me, yeah, very soon you will go to your home. So this type of false assurance you are giving to the patient, this is totally wrong. And lack of empathy, invalid emotion. So these all things, what, this is in non-therapeutic communication, totally different. Then what, active listening. Active listening means, yes, name itself you are understanding that actively we have to listen the patient words. Active listening means what the patient is saying. Already I told you about all that. So yes, again I am repeating, active listening. Then paraphrases means if he is not understanding one thing, you can use some more words, some different words that the patient can understand. If what you says to the patient, but he is not understanding, how he can understand? So in differently you can, different word you can use for the patient to understand or to make him clear. So this is what paraphrasing and clarifies information. Here everything here, whatever you are going to do, yeah, what is happening with the patient next, this therapy may change, your nurse may change. So everything you are informing the patient in where, in therapeutic communication. You are an active listener, whatever the patient saying, everything you are listening properly and giving answer to him for his satisfaction, for his better cure. But here what happened, you are just interpreting. Interrupt, does not actively listen, responds without understanding, means you are not at all giving importance to the patient, only and only what you are just interpreting. Again and again you are asking question and showing arrogance and very bad behavior to the patient, and you are not listening what the patient's problem. Only you are just managing your duty. I have to give this medicine to the patient, I have to do this for the patient, that much only. But no empathy, no emotion, just simply you are just doing your work very. So yes, you are everything, means without understanding, responding the patient. So this is all about what, non-therapeutic communications. And patient's involvement, how much you are involving with the patient. So encouraging patient participation and shared decision making. So everything here positive, you are encouraging the patient to do something, yeah, for any participation. If anything you are just making any type of task for patient, so you are making patient to, you are encouraging the patient to participate in this task and share decision making. You can say about yourself, what is your opinion. So like that freely you are giving freedom to the patient to talk to you, to share his decision. So everything, this is what, this is very positively you are showing everything to the patient. This is therapeutic communications. But in non-therapeutic, what happened? So here what happened? Everything is limit for involvement. Fostering a passive role means you are not being interest towards the patient, means your involvement is no any involvement. You are not showing any type of involvement, and you are just contacting, you are just talking to the patient in a limit way. You are not giving freedom to the patient. Yeah, what patient is saying you are not listening, just you are saying do the task and you have to do that. What is patient's problem? You are not understanding. You are not involving with the patient or fostering a passive role. You are not showing the involvement with patient and his decision. Next is patient involvement, means how much patient involved in the task which you have given to the patients. Means encourage the patient participation and shared decision. You are encouraging the patient for the task or making him freedom to take the decisions. So this is what verbal. But in non-verbal, what happen? You are just not may limit patient's involvement is very limit because of you are not encouraging the patient. Then fostering a positive role, yes, you are lacking this positive role, fostering it a passive role means visibly you are not involving with patient. Visibly you are not involving with patient's encouragement या patient task या something like that. So this is what totally negative. Then relationship building, yes, strengthen therapeutic alliances, positive outcomes. So these all things are there. You are strengthening the patients therapeutically you are just involved with the patient. Alliances means what? There should be a agree between the patient and you, that both togetherly you are cooperating with each other, and positive outcomes. So for all this, what happened? Your plan, your goal being positively outcome. Your outcome is positive only because whatever you decided together, you told to the patient agree with that, and you work there, and finally patient got relief from his problem and discharge, and last stage also came. So this type of relationship is there in therapeutic communications. Here what happened? May strain relationship or leading to mistrust or dissatisfaction. Your relationship is not so good, not a therapeutic relationship, it's a strained relationship, and means you are just behaving the patient like he is unknown to you. So this type of leading to mistrust or dissatisfaction. If you will not talk to the patient, if you will not show the best gesture to the patient, then how the patient can trust you? And yes, that surely the patient may dissatisfy about you. He will not be satisfied about your behavior, by your gesture, posture, your communication. So this is everything is about non-therapeutic communications. Then use of silence. Sometimes what happen? Utilize purposefully, means this silent. Why we have to be silent? This is for purposefully means according to the patient's condition, according to patient condition, we have to maintain silence, but not always we should be silent. If patient want to sleep, या patient mood is not good, या patient need privacy for some time, so that time we should be in silent. Not in always. Utilize purposeful silence for reflection or understanding, which I told you. But here silence may be awkward, conveying disinterest. You are going and sometimes you unnecessarily you are showing silent. You don't want to talk to the patient, disinterest, and because of that silent, directly you will go to the patient room and you will not show any type of gesture. You will not do any type of what to say, good words or good morning, yeah, good morning. You are not wishing the patient, simply you are just going and seeing the file and what all things you have to do. You just did that and you went. So this type of silence is really awkward. Patient being like he was being expecting something from you. So in that time the nurse came, so I can ask so many questions to the patient nurse, yeah, something like that. But in this time what you are showing the silence to the patient unnecessarily, so that may feel awkward, that may create a awkward moment for the patient, or and you are showing the disinterest to the patient, that things will be a negative effect for the patient. So this is non-therapeutic communications. Yes. Then last is what? Feedback and reflections. What is your feedback? Feedback provides constructive feedback and fostering growth. Yes, in therapeutic communications, we provide a constructive feedback and fostering growth. Means we are understanding about the patient and we accordingly we are giving treatment to the patient and everything, like everything we have given, and the feedback is really very constructive. The patient is very satisfied about your behavior, your communications, your work, your goal, what you have done with the patient. He is being totally satisfied. But here what happened? Everything means fostering growth. You are encouraging patient for everything. You are involving. You are involved. You are just involving in his work, in his everywhere task and everywhere. So this is totally positive. And negative, what happened? Feedback may be critical without promoting constructive improvement. So the feedback of the patient, what will happen? Because of your non-constructiveness, you didn't construct anything for the patient, and what will be the feedback? So that will be negative and it will be very critical. Means without doing anything, just simply you are doing all the things without talking to the patient, without communicating with the patient, only you are judging the patient, you are just interrupting the patient, you are not giving the freedom to freedom to the patient to talk with you. So these all things what happen at last, feedback and reflections will be negative in therapeutic, in non-therapeutic communications, but it is feedback is very constructive and fostering growth is there in therapeutic communications. And next is what? Cultural sensitivity, demonstrates cultural competence and sensitivity. Yes, this is a clinical things. Cultural demonstrate cultural competence means according to the patient culture and what is the hospital rules. So that togetherly we have to understand, we make them to understand that this you should not do like that. In this is hospital, you came here for cure and you should not do any type of fasting or any type of cultural things in hospital. So these things, what this is from two sides, from the patient and the nurse. So this is what cultural competence and sensitivity means. Togetherly we understand each other, because you make understand to the patient, their family member, and they cooperate with you, and there should not be any issue for your treatment. So in negative, in non-therapeutic communications, what happen, may exhibit cultural sensitivity or ignorance. You just ignore everything, what is patient's culture, what is patient's value, what he believe. So everything you being ignored, and you are not understanding patient's emotion, patient value, patient thought. So that will be what the sensitivity may cause, because that will be not work, that may hurt to the patient. So this is totally negative. So this is what cultural sensitivity means. The patient is not cooperating with you, otherwise you are not make him to understand, or you are not communicating properly with the patient. So that's why there is a cultural sensitivity, means you are ignoring everything. And when you make understand to the patient, of course the patient may cooperate with you in everywhere, but that is your fault, that you are not communicating with the patient properly, you are not talking with the patient properly. So these all are what about the therapeutic and non-therapeutic communications. Very shortly we will see, we show about the goal wise what is the difference, then focus wise, then verbal communications, how it has been differentiated, non-verbal cues, then empathy and validation, then active listening, then patient involvement, how much patient involved in therapeutic communication and non-therapeutic communication, then responsive relationship building. Yes, what is your relationship with the patient in therapeutic, and what is the relationship with your patient in non-therapeutic. Then use silent, where we have to use silent unnecessarily, we should not do any type of silenceness, may create a awkward situation. So that is for non-therapeutic. Then feedback, yes, I told you that when we involve properly with the patient, then the good feedback come. If you won't involve properly, then negative feedback come. Then cultural sensitivity, yes, this is the things which we this is the clinical policies in which the patient and the nurse can talk together, and the nurse can collect information about the patient, and accordingly their treatment plan will be they execute. But here the patient is not giving importance to the patient, the nurse is not giving any importance to the patient's culture, ethics, or any type of his value. So there what happen, everything will be negative. So these all are what about the therapeutic and non-therapeutic communications. Today we will show about therapeutic and non-therapeutic communications, as well as the difference between therapeutic and non-therapeutic communications. If there any doubt, any confusion, please give me in comment sections right there. I will see and tell you about the solution. If there any type of beneficial you are feeling, please do like and subscribe to my channel, and don't forget to click the bell icon. Thank you.